Welcome to part 1 of our hepatitis B virus lessons. In this first part, we'll talk about some basics of the virus and the specific diseases it can cause. And then in part 2, we'll cover the life cycle in a little more detail. But we got a lot to talk about, so let's meet our new and improved hepatitis hippo, the queen bee of the family. And also, I apologize in advance for any bee puns that hurt your ears during this lesson. So, the buzz, on this hippo is that it comes from the Hepadnaviridae family, and specifically the genus Orthohepadnavirus. Hepadnaviridae are DNA viruses, hence the cool color scheme in this bedroom. But just in case you forget everything you ever knew about Sketchy Micro, the letters D and A are literally spelled out in the middle of the word. Hepadnaviridae. So hepatitis B has kind of a weird genome. It's a circular loop that's partially double-stranded, but also partially single-stranded. That's because the positive sense strand is shorter than the negative sense strand. So somehow the virus needs to be able to repair this, and there we have it. Our classic reverso transcriptum spellbook that should remind you of the enzyme reverse transcriptase, which is an RNA-dependent DNA polymerase. I just said that the positive sense DNA strand is shorter, and the genome comes equipped with an RNA template to complete the strand. Reverse transcriptase is actually attached to the genome, so it is a major player in repairing the circular DNA, which is vital for proper synthesis of pre- and subgenomic RNA. But we'll talk more about that in part 2 on the life cycle. All right, our hippo's look isn't quite complete, so let's add a few more details to help you learn the key structural features of the hepatitis B virus. First of all, by the hood, you can tell that HBV is an enveloped virus, and these B antennas represent the very important hepatitis B surface antigen. Core protein, which makes up the nucleocapsid core, is symbolized by this chain bib, and related to the core protein is E antigen, represented by this E-shaped stinger. E antigen signifies that we've got actively replicating virus on our hands, and it also likely plays a role in infection by modulating the host's immune system. Okay, now that we've got the perfect B ensemble together, let's snoop around this room to learn more about HBV epidemiology and natural history. Hepatitis B virus is transmitted by sex, by blood, and in and around pregnancy, hence the various trinkets here on our hippo's nightstand. In terms of pregnancy-related HBV infection, there are a few things to keep in mind. First, there is a low risk of this virus actually crossing the placenta. Second, there is a very low risk of spreading the virus through breast milk. It's almost negligible, so breastfeeding should not be delayed. And third, due to universal screening and both passive and active immunization, the overall risk of infection in the baby is relatively low. But you should still know about this risk because there is a very high risk of chronic hepatitis B occurring in a baby born to a person infected with the virus. In fact, when it comes to hepatitis B, the risk of progression to chronic infection varies by age. To help you remember this, we'll use our grandfather clock, our recurring symbol for chronic conditions. Among infants, 90% go on to develop chronic hepatitis B, which is why we have this baby-shaped clock hand pointing to the number 9. This little tyke represents the risk in children, which is pointing to 5 to remind you of the approximately 50% risk of chronic infection among children. And then adults have the lowest risk, so this fully adult-looking clock hand is pointing to the 2. Among adult patients, there's only about a 2 to 5% or maybe even lower risk of developing chronic HBV infection. Okay, let's go over a bit about what hepatitis B infection looks like. With hepatitis in its name, we're pretty sure you can guess that this virus causes inflammation and tissue damage inside the liver, but it can also cause problems outside of the liver. Acutely, hepatitis B has sort of a generic trifecta of fever, rash, and joint pain. You may hear this described as a serum sickness-like illness. That prodrome is followed by an icteric phase, including jaundice, poor appetite, and right upper quadrant pain. For the most part, patients with chronic hepatitis B infection are asymptomatic, but symptoms like jaundice, splenomegaly, ascites, and so on can develop in those who progress to cirrhosis with liver failure, hence this liver-shaped plush toy that's unfortunately got the stuffing knocked out of it. Outside of the liver, hepatitis B virus can trigger the formation of immune complexes, which can do damage to the glomerulus and blood vessels. There are 2 HBV-associated glomerular pathologies to know about. Membranous glomerulonephropathy, or simply membranous nephropathy, is more often seen in children, and is likely due to complexes of E antigen and antibody. Notice our kidney plush toy is sporting this red membranous cape because you'll see nephrotic syndrome with nephrotic range proteinuria. Membranous nephropathy usually resolves on its own, though it can progress to kidney failure, especially if the patient is an adult. Less commonly, membranoproliferative glomerulonephritis, or MPGN type 1, can be seen. This will manifest as nephritic syndrome, think hematuria and some degree of proteinuria. Glomerulonephritis is triggered by immune complexes that deposit in the mesangium and subendothelial space, causing a tram track appearance of the glomerular basement membrane. To remind you of this buzzword, we've got this knotted red rope pulling this toy train here along those tram tracks. The classic vasculitis associated with HBV infection is polyarteritis nodosa, or PAN, which we'll symbolize with this Peace and Harmony poster. PAN is a necrotizing vasculitis that results from immune complex deposition in the wall of small and medium arteries. It can cause a wide range of manifestations involving the renal, cardiac, vascular, and GI systems. Okay, let's dive into a very important discussion on screening and testing. You'll get tested on this a lot. This graph of antigens and antibodies might look familiar, and it's a good idea to spend some time with if you haven't already. But for right now, we're going to focus on a few key concepts. There's actually a window of time where you'll see the disappearance of surface antigen without the presence of anti-HBs antibody. This is called the serologic window. To help you extra remember this highly tested concept, take a look at the sign outside our hippo's window, which features a canceled out B antenna, because there is no detectable surface antigen. But also notice that the Y stick stand is broken because we also have no detectable surface antibody in the serologic window. If surface antigen is negative and other antibodies are positive, including surface antibody and core IgG antibody, think resolved infection. Chronic infections are divided into two phases, an active phase and an inactive phase, marked by persistence of detectable surface antigen. Active chronic infection is marked by persistence of specifically E antigen with a very high load of viral DNA. In contrast, inactive chronic infection is marked by negative Hep B E antigen with positive anti-Hep B E antibody. Also, you'll see much lower copy counts of viral DNA. There's a difference between immune patients who are exposed to natural infection versus those who are vaccinated, and exam writers absolutely love to make sure you know that difference. Notice we have a similar B sign here to remind you of the negative surface antigen, but this time the stand is not broken because vaccinated people will have a positive surface antibody. Also, we have a syringe dart at the center to remind you that this is for vaccinated patients. So look for all other antibodies like anti-Hep B core antibody and anti-Hep B E antibody to be negative. Now that we know all about detection, let's briefly wrap up hepatitis B with treatment and prevention. Treatment centers on antivirals, specifically the NRTIs tenofovir and entecavir, represented by this Tryst in the Night reverso transcriptum book charm. The vaccine is a recombinant Hep B virus surface antigen and is recommended as a 3-dose series in all newborns and in high-risk adults, like those who work in healthcare settings where accidental needle sticks can happen. Okay, let's wrap up this sketch with a brief discussion of the hepatitis delta virus. Now, hepatitis delta, or D virus, is actually not a member of the family Hepadnaviridae because it's not a DNA virus. It's in a genus of its own, the genus Delta virus. But we're talking about it here because it's a satellite virus of the Hep B virus. Notice this wall poster here for the Delta satellites, with the Delta satellite invading the B planet. Also, by the negative cloud moon, you can tell that Delta virus is a negative sense RNA virus. There are two ways HDV can manifest depending on if the patient contracted HDV with or subsequent to contracting Hep B virus. Co-infection causes an acute and transient infection that you can't really distinguish from acute HBV alone. But contrast this with superinfection, where a patient who already has HBV contracts Delta virus. This initially leads to an acute severe hepatitis that progresses to chronic infection. Notice how we've got a Delta satellite sticker on the grandfather clock to remind you of the disproportionately higher risk of progression to chronic infection when dealing with a superinfection of HBV and HDV versus HBV alone. And finally, that's it for hepatitis B virus basics and infectious diseases. But there's plenty more fun ahead for you in part 2 of this story. You better believe it. Sorry again.